So Doctor will conduct today the training and the lectures and the workshop and the knowledge about the new line of the product. And he will share his own experience with the Infini skin boosters and own technique of injections. After the lunch break, we will have 3 patients models that will be having a treatment with doctor. So I hope you will get as much knowledge as possible with the new line of the products, and you will enjoy, again, as always, with Infini, the workshop. Thank you so much for coming. Have a nice time.
Thank you, Anna.
Thank you.
Thank you. Hello, everybody. Thank you, Anna, for inviting me here today. I'm so pleased to see these beautiful faces in front of me. I'm Yahia Hashish. I'm a dermatologist coming from Egypt. I'm based in Egypt and Saudi Arabia. Well, I've been an anesthetic injector for over 10 years now. Maybe some here have been older than me in the aesthetic field and more experienced than I have. But here I'm talking today about Infini. I know that you've come from different places of the world. So I know that we have Lithuania, I think, right? Lithuania, Poland, Croatia, Slovakia, okay, Iraq, my brothers, okay, Morocco as well. The Middle East is taking over so far, and UK. Hello. Hello, everybody. It's really a pleasure just seeing diversity over here, as well as we have in Infini. It's the diversity. That's what really caught my attention when I got introduced to Infini, Skin Boosters portfolio. This variety of products with different indications, with different modes of action, different effect on our patients. Well, not all patients can be treated the same. We should have different products or different ingredients with which we can personalize our treatments, of course. And that's what sets Infini apart from other skin booster products in the market, is the diversity and the variety of the ingredients, from different molecular weight hyaluronic acids to collagen, PDRNs, and all have evidence behind it. So today I'm going to be talking about V5, V20, PDRN, V6, and the lip booster. So we are all familiar with these products. Okay. Anybody haven't tried them yet? You've all tried them. ما في ناس ما بتردش عليا بتوع العراق ما بيردوش عليا خالص. Sorry? Okay, you just didn't try it yet. Okay. So basically we have those patients who need some tissue support, or we have some sort of, not volume loss, but the laxity that needs some plumpness or support that give this tightness and the illusion of lifting effect. That's where V5 can come in play. And others, they just need some hydrations. You feel that the skin is somehow dry, and they need hydration. There's some rhytids, very fine rhytids on top, and you see the dryness. That's when V20 comes in with the high concentration of hyaluronic acid. And of course, the PDRN, and we all know about the PDRN. We've used it in different products. And the V6 with the high concentration of hyaluronic acid as well, with other collagen, the soluble, the cross-polymer, the hydrolyzed collagen that gives some sort of immediate and long-lasting tightness effect on the skin. So I will be starting with the V5, which is formed of a combination of hyaluronic acid, low molecular weight and high molecular weight hyaluronic acid, all integrated with the patented trihalase molecule. Okay, so why would we have a low molecular weight and high molecular weight? The high molecular weight, we all know, it simulates the hyaluronic acid that we have already in our skin. So it's familiar for our body. It gives immediate structural support for the skin and high moisturization power. The low molecular weight, actually, it forms like, you know, this thin material that fills in the spaces in the dermis, the extracellular matrix, and giving it the environment, giving the fibroblasts actually the appropriate environment to proliferate and to start forming a new collagen and elastic fibers. And the presence of the trehalase actually, it's a product, it's a material that is present in plants, fungi, invertebrates, and it preserves these organisms. How does it do that? It's made of a disaccharide of glucose. This is the formulation of the trehalase. It maintains or it keeps the water inside of these organisms. How does it do that? By forming like a shield, a crystalline shield around the water molecules. So it maintains the moisture inside. And using this molecule with that specific product helps us to get a longer lasting effect of moisturization, because we are keeping the moisture inside the tissues for as long as possible. It's not just we inject the low molecular weight hyaluronic acid, we get fast, and high molecular weight, we get fast moisturization, and we lose it within 2-3 weeks. That's what we see with most of the products or the hyaluronic acid products, skin boosters in the market. Adding this molecule actually maintains the moisturization for longer time, and it doesn't interact with the lipids and the proteins of the tissues. So it is safe. It also maintains a thermal stability for the tissues as well as osmotic stability. It will keep the osmolarity of the cells intact. The cells will not swell and rupture, and they will not shrink and die or autophage. So it is a nice material to have in your skin booster for longer lasting effect. Well, for injecting the V5, there are different methods of injection. You can use a cannula, you can use a needle, but it depends on what exactly you want from that product. We are using that product mainly for structural support of the tissues, deep hydration, which is long-lasting, and it can give me this plumpness effect that can help me with some sort of contouring of the tissue, of the faces, especially for those who lack the contours. So mostly I'd be injecting it subdermally in the superficial fat compartments, or just subdermally below the dermis to be as near as possible to the fibroblasts. You can as well inject it in deeper layers to give support to the ligaments. So you can apply it in boluses, you can apply it in needles. Well, before I choose how to inject any booster in the skin, I prefer to get an idea about the cohesivity and viscosity of that product, to know exactly which layer I'm going to be depositing that product and for which benefit. And to do that, before I injected the V5, I studied, or I just tried to extrude it from the needle or my syringe under gentle pressure to see how cohesive the product is, if I can inject it intradermal or it's subdermally. So you can see it's a little bit cohesive with a moderate viscosity. That product cannot be injected intradermally. That product will be injected subdermally or in the superficial fat compartment. You agree on that? Okay. You can see how viscous the product is in comparison to others that I will show you. So I choose a cannula to distribute it in the superficial fat compartment or even subdermally. I can do a dual layering. Actually, I can inject it just subdermally by scratching below the dermis, and I can go a little bit deeper in the superficial fat compartment and distribute it all over the area I want to treat. It's beautiful to inject like in vectors, like to inject along the zygomatic arch, the lower face, the gonial angle, maybe the pre-jowl sulcus, and we will see all of that. We can use a needle as well with an angle of like 45 degrees. I don't want to be intradermal, because if I inject that product intradermal, maybe my patient will suffer of lumps or bumps that would last a few weeks because of this cohesivity. Okay, that was a video for the injection. We will inject anyways. Now the V20, which is a high concentration of hyaluronic acid, medium molecular weight hyaluronic acid. It's a beautiful product that has 20 milligrams per milli. It's 40 milligrams per 2 ml. You are providing your skin with a huge dose of hyaluronic acid that maintains and keeps the moisturization in your skin. It's beautiful for patients who need some hydration and moisturization for the skin. Those who have these, I told you, these simple fine rhytids caused by the dehydration they have. It's good for, I'll tell you, those middle-aged patients, maybe young patients who want some glow or improvement of skin texture, just improvement of skin texture without the structural support. And we have a lot of them in our patient. A lot of teenagers now are into skincare. They come to our clinics and they want something that would give them a beautiful a glow or some improvement of the texture, especially if they are into some sort of event or they're traveling and they don't want to have makeup on and they want to look bright in the photos. So this product will really help me a lot in such an instance. Have anybody tried that before? Nobody. Okay. So this is where we can use the V20. And actually, in those a bit older patients who want the structural support, I'll be combining both the V20 and V5. Again, the V5, I'll be injecting a bit deeper for the structural support to simulate the contours of the face, because it gives a bit of plumpness and a longer lasting effect due to the trehalose composition. This I'll be injecting mostly more superficial than the V5. We will see how it looks like on like the viscosity of it. Every time before I inject any skin booster, I prefer to examine its cohesivity and viscosity, because sometimes the recommendation, it's a bit, it has a viscosity almost near the V5, but a little bit less. We can inject it higher. So I injected deep dermal or in the subdermal layer with a needle as well, with the cannula, again, with scratching under the... Do you inject biostimulators? Anyone inject biostimulators, like PLLA or calcium? Yeah. Okay. Usually, how do you inject it? With a cannula, definitely. You don't use a needle. Okay. And you're not in the superficial fat compartment. You're actually trying to deposit it as close as possible to the dermis, right or no? Nobody's answering me. You don't use PLLA, you don't use calciums? Well, whatever, however you prefer. It depends on my patient, actually. If I'm injecting you, you have lots of hair follicles. You'll be so hard to inject with a 25 gauge cannula, so I'd be going for a 23 gauge cannula. In a female, without any history of maybe PLLA or history of facelift, or I see no scar, no acne scars, I can go with a 25 gauge cannula. It's easy to introduce into the skin, but when we have these fibrotic structures, we will need a stronger or a stiffer cannula. So I go with a 23 or a 22 gauge cannula. Though a 25 will make it easier to be just subdermally, or you know, it keeps the space. Always keeping the bevel up of the cannula. So it depends on your patient and how you, in the neck per se. In the neck, I go with a 23, not a 25, because it gives me less bruising, but still, how you feel comfortable with your hands. So that's how I do injections in the subdermal layer. Actually, using a cannula is much more comfortable for me as a doctor and my patient with very low downtime. So most of actually my skin boosters, those who have a bit of a higher viscosity and cohesivity, I prefer introducing them with a cannula for even a wider spread with less downtime, less bruising, less swelling, less, you know, for sure, and of course, less time in your clinic, so you can see more patients. By the way, the same effect. Have anybody used the needling and the cannula? Okay, so do you find difference in the effect when you inject skin boosters, per se? Sorry?
When you use the needle, you see the glow is faster, but when you use the cannula, it will be longer.
Okay, so injecting with the needle, the effect is faster. Okay, about that, well, my patients suffer from bruising, which makes them don't notice the glow that fast like the cannula. That's my experience with it. But if your patients find it better or faster glowy with a needle more than a cannula, then keep on using a needle. But sometimes you will need to be injecting your product. This product will be injected subdermally. So I believe a cannula would be easier and safer for the patient, especially if we're injecting, well, some dangerous areas. Well, that's how we can play with both products. As I told you, the V5, it's mostly for the older patients or those who have some lack of tissue support. Of course, they will not alternate or replace the filler to volumize or to replace volume, but they can help a lot with the improvement of our results, especially for the longevity of it and the duration. You can do it every month, you can do it every 2 weeks, according to the need of your patient. And the V20 is more for the younger patients who are looking for some hydration and glow. So you now get the difference between both products. I see he nodding, but I don't see it anywhere else. شباب المغرب, you got me, tu comprends, vous comprenez. I don't speak French, but I try to. Fine? Okay. واصل الكلام طيب؟ تمام? Okay. So, and we still can use both, because some patients, you know, this GLP-1 era, patients are losing not only fat, but they're losing the thickness of the skin, of the dermis. So I believe in these patients, especially they're mostly in the 20th, the 30th, okay, they take these medications and they start looking drained and tired and actually older in age. I believe in these patients will benefit a lot from the combination of both the V5 for support and increasing the density or the thickness of the dermis and the tissues, and for hydration or prolonged hydration of the V20. You done? Okay. Now to the other part, which is the PDRN. We all love PDRN. We use it a lot in our clinics. Our patients are always asking me for salmon DNA. and they don't know exactly what Salmon DNA does, but it's a beautiful product, and we've seen a lot of benefits from it. I love the concentration of hyaluronic acid in this PDRN product. I'm using the one with the vial. It has very low viscosity, so I can inject it intradermally where the fibroblasts are actually where I want to have my PDRN deposited, in the vicinity of the fibroblasts. Sorry? Needle. I'll show you. I'll show you. Definitely, if I'm in the dermis, it's a needle all the way, because I cannot maintain a dermal level with a cannula. Okay, and of course you inject it with needles in your clinics. This one I'll have to inject with the needle, and my patient will bruise, and my patient will suffer for like a few days, and then she will love the effect later on. So the PDRN, you know, by aging, there is reactive oxygen species, stress in the tissues, increased inflammatory cascade, decreased collagen formation due to the increase of the matrix metalloproteinases. And that's where PDRN comes in play. It interacts with the receptor, the adenosine 2A receptor on the fibroblasts. Actually, it stops all these cascades. The pro-inflammatory cascade, it stops it, so it has an anti-inflammatory property, as well as decreasing the matrix metalloproteinases, increases collagen formation and decreases the destruction of the collagen fibers within the dermis. Plus, it gives us the pyridine and pyrimidine blocks for the DNA and RNA repair. It's a beautiful product. We've all used it, especially the last. How many years have we been using PDRN in our clinics? Like 2 or 3 years, something like that? Sorry? Yeah, something like that. And it's so popular and trendy, but it's not just trendy. It's really effective, and we see the effect with our own eyes, the regeneration and the repair that happens to our skin. So it's a beautiful product actually to incorporate with other treatments in your clinic, especially with its ease of injection. It increases the angiogenesis as well through the vascular endothelial growth factor, as well as decreasing the melanogenesis. We've seen our patients when we inject them with PDRN, their melasma, their post-inflammatory pigmentations actually decreases. Yeah, we need other modalities to improve that, but it's a very good combination or a very good treatment to combine with other modalities in our clinic. So this 8-point technique with the PDRN, I don't think it will work with it. Neither this one. I love this one for PDRN. Okay? Just flood the whole area with the intradermal injections. Your patient has these blabs. I love how it looks like. It's like an artistic, canvas in front of me. Intradermal injections. I'm tangential to the skin with my needle. I use a 30-gauge needle. I don't know if you use a higher gauge like 31, 32, 33, whatever you feel more comfortable with. And the F6 as well has the same. I'll show you a final video for both products because they have almost the same viscosity and cohesivity. But this one is a beautiful one. It has different types of collagen. The soluble one that is water soluble, the cross polymer which is formed of different peptides, and it forms this collagen bundles that are ready to form collagen, thick collagen bundles, as well as the hydrolyzed collagen. Well, let me put it simpler. Soluble collagen is simply water soluble, so it easily diffuses within the tissues in the product that we've injected. The hydrolyzed collagen is like big polymer that is broken into smaller peptides, ready to form new collagen bundles. So it gives me the building blocks for collagen formation. And the cross polymer of collagen, which is actually collagen fibrils that are ready to form collagen bundles. And these give a more instant effect than other types of collagen that are present in this product. So we have the instant effect, and we have the long-lasting effect of the collagen. Plus the high concentration of hyaluronic acid in the syringe more than the vial, but I've been using the vial, and it's giving me very nice effect. So this is what I've been talking about. Okay, that's how the collagen is formed of amino acids. We put on the amino acids together, we form a peptide, more peptides, we form a whole collagen fibril, then the collagen fibril in like helixes, forming the collagen bundle. Okay. It's the same way, injected the same way as the PDRN, intradermally, tangential. I'll show you the cohesivity and viscosity of it. Again, always check the product before you inject to make sure that your patient will not get into any problems later on. You see, this is the canvas I'm talking about. Our patient leaves with these blebs. It looks beautiful. I love watching this. Sorry, I used 2 needles. I used the 30 gauge on a regular syringe, and then the BD syringe with the 31 or 32, especially in the forehead, because in the forehead, I fear vascular occlusion, but it's not vascular occlusion, it's blindness. And I have a product that may have a higher viscosity than the blood. So I prefer to have a needle, a syringe in my hand with which I have higher control on pressure on the plunger, the amount I inject per bolus, and the layer I'm injecting in. I don't want to be anywhere subdermally. I want to be strictly intradermal, especially in the forehead, for safety reasons. So here I'm using different kinds of needles or syringes. The first one I took like in the 3 ml, and I injected the whole face. And then for the forehead, I backfill the BD syringe, and the one that you use for toxin injection. And that's the patient the next day. That's what I'm talking about, my friend from Iraq. He's not here with me. He's chatting with someone who makes him smile. And see, this is her next day. Well, the blebs are gone, but she's stuck with some, so she will not see the glow actually. Okay, she will always, well, when I had the glow, I had bruises as well, so, okay. But in this treatment in specific, the F6 and the PDRN, I'll be using the intradermal injections like that. I can inject everywhere, the face, the neck, décolletage, hands, maybe whoever does the sensitive areas as well. It's fine. So how can we integrate these 3 different products together, the V20, the PDRN? Well, the V20, it hydrates the skin. We talked about that. The PDRN, of course, for the cellular repair and regeneration, and the F6 for the tightness it gives for your patients. Now, with a personal favorite skin booster, a lip booster. There have been so many lip boosters in the market that I don't know if they really work or not, but most of them have high viscosity that it gives some plumpness of the lips, and they are injected in a way that actually makes the lip look really unnatural, and they lose the shape of it. So that product really, I enjoyed using it because it adds nothing to the volume of the lip, which my patients who are asking for lip boosters actually are asking for. They don't want any volume. They don't want any lumps in the lips. Some of the boosters out there used for the lips, they actually forms lumps and lumps in the lip. This one really flows so smoothly. Even the patient don't suffer or complain of the swelling that occurs after injection. And that for me was somehow confusing, because I'm used, whenever I inject a patient with anything in the lip, she will swell naturally. But with that product, I didn't experience, my patients didn't experience that swelling that I was suspecting. So it has a high concentration of non-cross-linked hyaluronic acid, as well as vitamins, vitamin B12, and peptides. It's a beautiful combination. The vitamin B12 has the anti-inflammatory property, as well as the cellular regenerative property as well. It hydrates the skin, and it forms a protective tissue layer in the tissues against reactive oxygen species. So I love this syringe because it had a bubble in it, and it showed me the viscosity and cohesivity without even using it. It's like a tube of water, just water, but it has a lot of a high concentration of hyaluronic acid, as well as the vitamins in it. It's a beautiful combination that gives really nice results, and the patient sees the glow. You see the bubble moving up and down? Okay, so it's just like water. It has no viscosity, and it will not cause any lumps or bumps or any swelling. And see how it flows out of a 30 gauge. It's like water, not like other products that I've shown you earlier. How I injected like you inject your skin boost or your fillers, maybe vertical threads, pens, or however you call it, horizontally, using a cannula. For whoever is a fan of cannula in lips, anyone is a fan of cannula in lips here? Sometimes yes, sometimes no. Okay, so when do you use a cannula in the lips? Flip? So you inject it muscularly or superficial? You're talking about a filler, just a filler, regular filler. And the cannula doesn't give any volume for the lip? Hydration? Fluffy. Mm-hmm. Mm-hmm. Do you think it's the cannula or the needle, or it's the product that you're using? Is it the same product? But with the cannula, it gives less volume. Okay. Well, but it's, I believe the cannula in the lip, the lightest, the cannula in the lip is more have higher discomfort than the needle to the patient, so in your hands, but it depends on the hands of. Mm-hmm. Beautiful. Without injecting the whole body of the lip. Okay, makes sense. Makes a lot of sense. I used to use a cannula for the lip when I had very thin lips, where I don't have enough red lip to introduce my needle. So I give it some volume, or give some ground substance, for which I'm going to use the needle afterwards.
What is nice is the cannula is really good.
Okay.
But they don't want the lips is mature. They mature the Even when I was solo at the end box, is when you come down, just perfect for them.
Okay, that's amazing. So these are the ways you can inject differently. Of course, we are all familiar with where you want to place your product. It depends on the angle you go with the needle and the length of the needle itself. And thank you. That's it for the. So please, I want to listen to all your questions, if any. One was awake enough to listen to me. Okay.
Related to this booster,
Yes.
how long it lasts?
How long? Well, you can do it. You can do it every month or two. Actually, it gives really nice results, especially this concentration of hyaluronic acid with the peptides that you have. Actually, you give the skin the ingredients to form new collagen and to improve the dermal thickness. So actually, it lasts quite well. You can do it every month or two.
Because I done it myself. I did try the
And the lip booster for
yeah for try because I do first time myself.
perfect. You try it on yourself first. It's amazing. I do the same.
I started last week, and then it just took me 2 days swallowing, and then just
You swell.
yeah.
That's
I got the photo. I got the video.
okay. I want to see it because my patients didn't. My patients didn't experience that swelling.
I used 30, 31.
No, so use
And then
33.
and then 32 by side.
I use 33 gauge needle for the booster, the TSK, flow easily. Nothing, I can show you that. Even
Let me ask you something. How you injected in a big bolus or you distributed all over the lip?
I did first the shape first.
Okay, so you introduced
Like
multiple linear threads. Well, according to my humble experience with that product, I didn't experience. My patients didn't experience that swelling, not the instant one or the one the next day. But if you feel that you need more, you can do it after 2 weeks. And it depends on how your patient responds to the treatment. That's what we do with all types of treatments. Okay, with skin boosters, you can do it every 2 months, every 2 weeks, every month, every 2 months. I have patients who get the V20 or the V5 with toxins, which is every 5 and 6 months, and the skin quality is so much improving. So I believe this high frequency of skin boosters, yeah, it adds to the effect, but it's not the guarantee that your skin booster, without it, you'll still reach beautiful results on the long term, especially if you have a product that guarantees this longevity. Okay, so. Patients.
Yes, as a doing in the for this
Temples.
Yes, the temple is 520s. As a conception in the doing in the face lifting is a 5 doing in this strategy and this strategy. What's your conception?
Well, let me break it down to you. Well, you notice that I haven't said anything about lifting. Okay, because for me, I'm not a believer that I'll inject a deposit, bolus of gel that will lift the face. What I'm doing with the V20 or the V5 in specific, I'm adding to the tissue's structure, to the density of the tissues, the collagen, the extracellular matrix. Okay, so this gives support for the tissues. It gives an illusion of, it gives tightness, it gives you some tightness. The vector, you mean? Well, I love it with the V5 because I'll be injecting it where I need more thickness of the tissues. Okay, so I'll inject it on top of the zygoma. I'll inject it at the gonial angle and the pre-jowl sulcus. Not the jowls. I will not add to the jowls. Well, whatever product that I have that would increase the thickness of my tissues, I will not be needing more of it where I'll have hypertrophy of the superficial fat compartments, which are the nasolabial folds and the jowling. So I'll be away from the nasolabial fold itself, the superficial fat compartment, and the superficial jowl fat compartments. I'll be away from these parts. Maybe I can distribute it a bit medial to the nasolabial fold, not lateral to it. Okay? Because if I add more lateral to it, so I'm adding to the tissue density in the lateral part, which would add later on to the folding of the nasolabial fold. So I hope I answered your question, or didn't I? Either. But this lifting word, or this lifting thing that are being used with fillers or skin boosters or even biostimulators, for me, personally, professionally, I haven't seen lifting. I see like how you ladies work with makeup. What do you do? Just apply, you can have like a saggy face, but you apply highlight and some contour below it. And you find you find yourself, oh, not yourself, you are all beautiful, you don't need any lifting, but you find that you look more lifted. So it's an illusion. We play with light and shade, actually. Well, I will not just, we are going to pillow faces because, and patients are getting wider because they are injecting in the back to have lifting and no lifting occurs. And
It's a doctor, as I think so, as a man and a woman, and the man effect is more effects in the woman. You know, you think so?
well, I actually, I haven't noticed the difference between men and women. Actually, you know what? The less you do to men, they really appreciate it and they find a lot of effect. Men tend to be contented and fine with whatever they get, not like women. Women are some way hard to please. But no, really, maybe for females, my patients, all our patients are more exposed now. And what we do, unfortunately, some of us do on social media is that we communicate so high hopes and promises to our patients regarding the skin boosters, the biostimulators, and that they will be magical and they will lift the face and they are replacement for fillers. And we don't see that in our clinics. Skin boosters cannot be replacement for fillers. They would improve the results after volume loss, after building the contours of the face with fillers. Yes? Because I'm not, again, I don't inject usually at the 5 points. This 5-point part, well, you add to the thickness of the tissues in this area, and that gives you some sort of volume replacement, which gives you the illusion of lifting. Okay, you injected where you have some volume loss, bone loss, volume loss, volume loss, bone loss, bone loss. These are the 5 points. Here as well is volume and bone loss. So you inject it, you add more to the thickness of the tissue, you add more to the hydration of this area, and this gives you the plumpness that gives you the effect of the illusion of lifting. Okay, but this can cause tightness. What happens is that your skin becomes tighter. And I prefer using the vector technique. I prefer using entry points through which I distribute my product in a way that will get my tissues, like, pull it backwards a bit. Okay? I'll distribute it in a larger area. I'll give density, thickness to the tissues in different areas, not in points. That's my preferred way of injecting these points. Cannula. Not more tightening, not like that, but it's a more globalized effect, not like concentrated in certain points. Okay, though these points that we are injecting it are the points that suffer from lack of volume. Maybe the bone, there is bone recession, or there's fat loss. So that's why we use these specific points. But for me, in my practice, according to my humble experience, I haven't found the effect that I get with the cannula, injecting it in this manner, distributing it in a wider place. I don't know about you, if whoever tried the cannula versus these 5-point injections. And tell me your feedback. Yes, you did. I know you're smiling. You have something to say. You mean the superficial fat and the deep fat as well? That's if you're using the V5 in specific.
Yes, you can use the D5 for both, actually. You just need to tell to your patient, like when you do that with superficial fat compartments, the deposit it will last usually up to 48 hours and they will go. Because like you said, the product is a little bit thicker, so it will be visible a little bit longer, but then it will go smoothly in 48 hours. I never had that problem with it. Or you can mix, or I can mix that with, for example, V1 or V2, which is more liquid product, so I can dilute it a little bit, so I don't really have this visible boluses for that long.
Beautiful. So again, there is no right or wrong. Well, yeah, there's no right way or a wrong way. There's my way and how I feel comfortable with my patients, and my patients find results. Okay?
Have you got any experience of using products on the body? Like, we have, for example, like
Well,
knees or like arms?
the knees, above the knees, actually, and it's really nice. I think the V20, not the V5, V20 would be very nice in such an area. Okay, it gives hydration and improvement of the simple righties. But in these areas in specific, I prefer using biostimulators, stronger one. Okay, I'm a calcium injector. But I as well combine it with a low viscous skin booster, which would be the PDRN, and the PDRN with the when I do a hybrid with the calcium, with this low viscosity, it's beautiful because you know what? It doesn't form a film around the calcium particles, and it makes it easier for the fibroblasts to get in contact with the calcium particles. And still, it regenerates the tissues with the calcium. So PDRN with calcium in this instance, regarding the above the knees and the buttocks, and as well around the umbilicus in the abdomen area, and it's very nice over there.
And I have one question as well. Sorry.
Please.
For example, because we live in a world when everyone is filmed so much, and nobody wants to be filmed that much anymore. So
True.
dissolving, especially the lips, need to change everything with information. For example, the lip booster is going to be a good product for lip regeneration after however days before the filling. What do you think about that?
That's a question that I haven't thought of, and I haven't, but I believe it's always good to hydrate the tissues. Okay, because after hyaluronidase, your tissues are becoming, the hyaluronic acid content actually of your own body is dissolved. But again, there is new regeneration of the your own hyaluronic acid within 24 hours. So you replace the dissolved hyaluronic acid, yours. Definitely adding more hyaluronic acid is good. Adding the anti-inflammatory part of the vitamin B12 complex and the regenerating power of it would be another good thing. But will it help with my filler injection later on? Maybe it will not help with the healing of the tissues or healing of the channels of if I have migration per se. It will not help a lot with that in that instance. You know, we have channels for migration that unfortunately stay there. And if you get your patients injected in the right technique, even after injecting, your patient will suffer from the same problem again and again. And that's why I'm refraining, I'm staying away more from dissolving nowadays. Because what I've found is that we believe that after dissolving, we will be able to solve the problem our patient had, or we find out that our patients get the same problem with the right product or within the right product and the right technique.
Sometimes we have albumin dissolved and they don't really want to fill back. The skin is quite a pressure around the lips.
It would be very nice. Yeah, it's a good product. It will improve your fine wrinkles somehow. It will give some rigidity to the tissues, or some, it will add to the ground substance of the tissues, to the cushion effect of the tissues. So definitely, it's a beautiful product. You can use it with fillers. Even the patients who had already fillers, but they want some improvement of the quality of their lips, or the glow, or the improvement of the fine wrinkles. We have a lot of patients who come after fillers, like after 6 months, they think they lost the filler because they started to get back the wrinkling of their tissues, which I believe it's a natural thing, but we can improve it using the lip booster, and you can do it every month, every 2 months, whatever.
So we can basically even kind of like extend the longevity of the filler. That's true. Though it differs still from one patient to the other, this duration of the filler. I believe that the boosters that we use really help to improve the results of the fillers that we've injected in the face, wherever. Because they give better support for the tissues, for the skin envelope. So they give a better effect, and they improve the effect of the filler that we've already injected. About the duration of the filler, I believe it really differs from one person to the other, and from one area to the other, and of course from one product to the other. So some patients actually, you reach the final result with the fillers. You injected however volume of fillers you've injected, and for like 3 or 4, and your patients stay with the result for 3 or 5 months. Yeah, you got 3-5 years, okay, with the same result, needing no more addition of volume, but you're just improving the skin quality. Did this really affect the duration? I cannot tell. Okay, I don't have a study that to tell that it does affect the duration of the filler or no. So it's something that I cannot really answer. Maybe not duration of the filler, but I would say like visible kind of effects.
That's true. I believe we all agree on that using the right boosters or the right skin boosters for your patient after fillers really improves the effect, or shows the effect even better. Because if you improve the skin envelope, everything appears better. Okay, you can use the PDRN. It's very good. It improves a bit the pigmentation, but there's something with the dark circles. For me, it's natural. I will not be able to improve it. So it's about the cause. Is it an intrinsic one, or an innate one, or acquired one? If it's the nature of your patient, I don't think you can do a lot with the pigment, but you can improve a lot the skin quality, the texture, hence some glow, hence improvement of the visible darkness. But if you... if it's natural, if it's maybe from where you're from UK as well? Poland. Well, from where you come from, you don't have these dark circles. And if you have it, or naturally, and if you have it, then it's mostly acquired. Lifestyle, maybe smoking, you will improve this because this will improve the vascularity. PDRN will improve the vascularity of the tissues in this area. So will decrease the hypoxia, which is the cause for darkness. And if there's some pigment, it will reduce the melanogenesis. It will improve reduce the pigmentation, so it will improve it. So it depends on the cause. And of course, you will look for some, if they have any general disease or weakness that needs to be addressed to improve your result even more. But definitely it will help, at least with the skin quality and texture. I use the BD syringe. I don't have these in Egypt. I use the BD syringe and I just introduce a part of the bevel of it and small blebs. Okay, I can show you later how I do it. And actually the patient on the next day, she would have some bruises, let's be honest, maybe a bit of swelling, okay, and it depends from one patient to the other. But there will be no residual blebs on the following day because of the low viscosity of that product. Definitely. But I don't have that in Egypt, so I have to work with what I have. Sometimes I bring it along with me, but I don't feel, I got used to using the longer needles. So I know where I introduce how long of the needle into the skin to be safe.
So one question. It says the bracket and the lip glass. What's your strategy?
The what?
Lip glass. It's a new product.
Yes.
It's maybe it's so eye from the eye, lip from the revitalization. It's an older mouth and younger mouth.
Okay, so older lips, older you mean which age?
You know it's the age. It's an older mouth in the Poland when you more doing in the hyaluronidal acid. It's
To plump it.
It's the plump. It's a Ukraine strategy than Russian lips.
Okay, to flip it.
Yes, to flip. It's a more maybe it's so 2 milliliters in the 1 milliliters and 1 milliliters as a country Ukrainian is a Russian lips,
Mm-hmm.
That now it's these lips is older. It's a no age old, but it's a mouth old.
It looks.
Yes, it's a looks.
Okay, well, if you're talking about volume, you will. Sometimes thin lips give us an older looking age, okay? So we need volume replacement. We want to give them some pout to show this younger appeal, okay? And you will be using the lip booster. On the same session, I'd prefer to put it on another session, and I never inject a whole 1 ml in the whole lip in one session. I never do that, not even 2 mLs. I inject maybe less or more than a half ml, average half ml in a session, and then 2 weeks later I do a touch-up with another half ml. So I reach, especially in thin lips, so I reach gradually volume for the lips without, if you add a lot of volume to tight tissues, your filler will not be accommodated inside the tissues comfortably, and it would be pushed away. And that's when we find the word migration, which is the filler didn't decide to migrate. Fillers do not have legs or wings to migrate, So it's our technique. It's the volume that you inject in the product. So you start with little volume and build up gradually. Okay, and definitely using a lip booster in such an instance would be very nice because it will add to the extracellular matrix, okay, which is the cushion, which is the tissue thickness, which is you want to add more volume more comfortably. So it may help you to reach better results faster.
Lately we had the Infini workshop for PDRN. So the doctor was injecting with cannula, the syringe one, not the vial. Used a fan technique to the face, near to the cheekbone, and go all the way with the jawline. Used about 3 ml each side. What do you think about it?
Well, what's the main action, the mode of action of PDRN? On which cells? Fibroblasts. Okay. So where do you want to place your PDRN? Where the fibroblasts are abundant. Okay. And where do we find that? In the dermis. Okay. So using a cannula with such a product that has very low viscosity, I think you will end up with most of your product spreading deeply. So less in contact with the fibroblasts. So you will be losing most of the effect of the volume that you're injecting. I believe with such a product, I'm not a fan of this multiple injections because it takes time from me in the clinic. Patient has a longer downtime, okay? But still, I'm looking for the benefit of my patient. I'm not looking for just my comfort and his comfort. I'm looking for the main benefit. So for the PDRN, I will want to have it placed where there is abundancy of fibroblasts in the dermis to find the best result of it. Like when you use when you use PLLA or calcium, you cannot actually inject it intradermal because you will not be able to use the needle because you will fear the lumps and the nodulations and the collection of these products in the dermis. So you use a cannula to distribute your product safely. But when you use that cannula, you want these particles to be as close as possible to the fibroblast, where there is abundance of fibroblasts. So you are scratching under the dermis. So you're placing it too close to the dermis. You're trying not to place it in the sub-Q. You're more towards the dermis. So using a cannula will not place my PDRN as much as, the main part of it will not be in the, especially with this low viscosity, it will spread even more. So you're losing, you're mostly stimulating the fibroblasts within the fat septi. You may add to the density of the fat tissue, but that's a way to look at it. It's not a bad thing, but, well, it depends on how she sees her patient. For me, I'll still inject it intradermally, or maybe I'll be using another product for higher moisturization of the skin or higher hydration of the skin.
This kind maybe we back to B5 or
Something like that, yes, most probably. Any other questions? Okay, so thank you, and we'll have We'll have the injection session in